Hospital corneal retrieval. Definition. Corneal retrieval involves surgically removing the cornea, the transparent, dome-shaped front layer of the eye, from a deceased donor for transplantation. Purpose. Supplies tissue for corneal transplants, keratoplasty, to treat blindness or vision impairment caused by conditions like keratoconus, Fuchs dystrophy, corneal ulcers, or trauma. Anatomy recap. Cornea, avascular, 5-layered structure, epithelium, Bowman's layer, stroma, Descemet's membrane, endothelium. Functions: refracts light, protects inner eye. Thickness: 0.5-0.6 mm centrally, slightly thicker peripherally. Timing: optimal retrieval within 6 hours post-mortem, viable up to 12 hours if body is refrigerated. Endothelial cell viability decreases over time. Legal and ethical considerations. Consent. Obtained via donor designation, example driver's license, registry, or family authorization after death. Nurses verify consent form completeness and signatures, escalate discrepancies to supervisor or OPO. Ethical principles. Autonomy, honor donor/family wishes. Beneficence, maximize benefit to recipient. Dignity, treat donor body respectfully, example close eyes post-retrieval, avoid unnecessary exposure. Cultural sensitivity. Some cultures/religions, example certain Jewish or Islamic traditions, may object to organ donation. Consult family preferences. Legislation, governed by laws like the Uniform Anatomical Gift Act, UAGA, in the U.S. nurses should know local policies. Eligibility for corneal donation. Eligible donors. No strict age limit, newborns to elderly can donate if cornea is healthy. Poor vision, example cataracts, glasses, doesn't disqualify, only corneal health matters. Screening process. Medical history review, check for systemic or ocular contraindications. Physical exam, inspect eyes for trauma, infection, or clouding. Contraindications. Infectious diseases, HIV, hepatitis B/C, syphilis, active sepsis. Malignancies, leukemia, lymphoma, or metastatic cancers, solid tumors like breast cancer may still allow donation. Ocular issues, active infections, example conjunctivitis, keratitis, recent eye surgery, or severe corneal damage. Special cases. Diabetes or hypertension, usually acceptable unless cornea is compromised. Trauma deaths, accessible if eyes intact. Role of the nurse. Identification. Screen patients at death, example ICU, ER, for donation potential. Collaborate with physicians to confirm brain or cardiac death. Notify eye bank or organ procurement organization, OPO, within 1 to 2 hours of death. Family interaction. Approach with empathy, we're exploring ways your loved one can help others through donation. Answer questions, it won't change their appearance significantly or it won't delay the funeral. Avoid medical jargon, offer chaplain or counselor support if needed. Pre-retrieval preparation. Confirm death, time, certification, and consent documentation. Position body supine, head elevated 30 degrees to reduce edema. Cool environment, use refrigeration or ice packs around head, avoid direct eye contact, if delay anticipated. Clean face, close eyelids gently with tape if needed. During retrieval. Set up sterile field, drape, gloves, instruments, forceps, scissors, saline. Provide saline to moisten cornea if technician requests. Assist with positioning or stabilizing head. Monitor for breaches in sterility. Post-retrieval care. Apply moist gauze or prosthetic eye inserts, per protocol, to restore natural appearance. Reposition body, cover respectfully, and prepare for morgue transfer. Notify family retrieval is complete if they wish to know. Procedure details. Performed by eye bank technicians, ophthalmologists, or trained hospital staff. Nurses may assist, rarely perform. Methods. Enucleation. Entire eyeball removed via incision around orbit. Cornea separated in lab, allows additional tissue study. More invasive, less common today. In situ corneal excision. 2 to 3 mm scleral rim excised with cornea using a Trephine, circular cutting tool. Minimally invasive, preserves facial structure. Steps. Sterilize eye area with antiseptic, example povidone. Use speculum to hold eyelids open. Excise tissue with precision tools. Place cornea in preservation medium immediately. Duration, 15 to 30 minutes per eye, bilateral retrieval common. Preservation. Stored in media like Optizol GS or Usol C, nutrients, antibiotics. Kept at 2 to 8 degrees Celsius, viable for 7 to 14 days depending on medium. Key nursing considerations. Infection prevention. Use gloves, masks, gowns, avoid touching cornea directly. Discard contaminated instruments immediately. Documentation. Record, time of death, consent details, retrieval start/end times, staff involved, eye bank contact, and tissue ID number. Note any complications, example tissue damage. Emotional support. For family, acknowledge their loss while explaining donation's impact. For self, debrief with team if procedure feels overwhelming. Equipment familiarity. Know where retrieval kits are stored, check expiration dates. Potential complications. During retrieval. Corneal perforation or scleral tear, rare with trained staff. Contamination if sterility breached. Post-retrieval. Tissue rejection risk, recipient issue, not nurse's concern. Storage failure if temperature not maintained. Patient/family education. Common questions. Will it disfigure them? No, eyes are closed or prosthetics used. Does it cost anything? No, donation is free to families. Can we still have an open casket? Yes, retrieval doesn't interfere. Key points. Only cornea, or eye, taken, not whole face. Process is quick, respectful, and helps restore sight. Practical tips for nurses. Preparation, review hospital policy and OPO contact info ahead of time. Teamwork, coordinate with technicians, clarify your role beforehand. Sensitivity, practice phrases like, this gift could help someone see again. Self-care, reflect after emotionally intense cases, seek support if needed.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.